Hello and welcome to another episode of Topic North Texas with the North Texas Commission. We're excited to have you here, all 30 or 40 of you. It's awesome. It's awesome. So we're having some fun. The second half of today, we'll be talking with Claire York from Blue Cross and Blue Shield Healthcare, and so stick around for that. But first up, we got drama.
We've always got drama. First thing to talk about, no data centers right now.
None.
Abbott said, actually, I read polling and no mas.
It's the fastest 180 I've seen in a long time.
We went from some regulations proposed to maybe not in rural areas to just, you know what, cut them off. We're not approving any of them right now.
No.
I am incredibly interested to see what happens from November 4th to the session starting.
Absolutely.
And then what happens during session with data centers.
Well, I think Sid Miller has it right. It's like the government.
No one has ever uttered that phrase before, so I like that.
But I mean, he's really pushing on. The governor could call a special session. There's all sorts of things
The governor is not going to call a special
He's
session
not going to do
before the election. That was
not
crazy.
going to happen. So it's fascinating to watch.
So we are still working on our policy plans for data centers because we know they are needed to keep the kind of jobs that are going to keep our economy thriving. We support sensible regulation. So watch the North Texas Commission, watch that space. We're going to come out with our full policy plans for that coming up soon. Collin County had a big week.
They had a moment.
First of all, on Tuesday night?
I want to say Tuesday.
I think it was Tuesday night. McKinney had to vote on approval of plans for a mosque in their community.
So and not approval plans for a mosque.
Zoning.
It was simply an expansion of an existing.
It is legally allowed. This should have been a quick up-down vote that no one ever paid attention to.
Yeah.
Congressman Self, who covers his district, covers McKinney, basically went on social media and said, this is how you fight Sharia law, by stopping this mosque, which legally has a right to build and expand.
Not only legally, but it's been challenged to the Supreme Court.
They would have been sued immediately.
Churches can be built in any zoning in a city, period, end of story, bar none.
And so what happened from that is hundreds of people went to the McKinney City Council meeting.
They did.
On both sides, to protest, to support. You saw some really fine examples of humanity, I would say, and some really not great examples of humanity, maybe, in some things that were said. What I think is interesting from a political standpoint is how much this points to what the Republicans are using as a platform for the midterms.
Right.
And they are trying to drum up that grassroots support. And Sharia law is one of the things that polling must be telling them is resonating with their voters and their grassroots, because you're starting to hear about it more and more. I see it. I get text messages from candidates about, you have to vote for me or it's going to be Sharia law. And so that's a fear point that they are pushing on for this election. I think we'll continue to see that.
Absolutely.
I'm sure for someone like you who is a mayor, you love the thought that it's blending into the municipal.
Yeah, it's so
space.
exciting to get that kind of stuff.
It's worth noting McKinney voted 9-0 to approve it, as they should have, as it would have gone straight to court and cost the city millions of dollars.
Millions, and then they would have been able to build what they wanted to.
Anyway. Yes.
So, yeah, absolutely.
And then I'm going to pivot to Tarrant County. Then we're going to come back to Collin County.
Okay, we're going to roam the region. Okay.
In Tarrant County, Tarrant County is widely considered the largest, most urban red county in Texas.
In the country?
In the country. It's under threat this midterm. And Judge O'Hare and the elections administrator for Tarrant County brought a plan and basically said last week, we're going to eliminate half of the voting sites on Election Day. And you can't really tell which ones. It didn't get that far. It did not pass. They were also going to eliminate 8 of the early voting locations. So those are locations that will be available for the whole 2 weeks. And those were primarily locations in...
It was near the college.
It was near colleges.
Yeah.
It was near more urban centers.
Yeah.
That they were going to eliminate. It did not pass. It is going to come back, I believe, this week in their meeting. But we still do not know what the proposal will be. It's a reduction of voting locations. We don't know how aggressive it will be. But Tim O'Hare is widely considered to be he's having to run as if he has a race this time.
That's right.
So that's going to be fun. And then to quote our friend and we're gonna call him fellow podcaster, like we're anywhere near the level.
No. We're coming. We're coming for you. It's happening.
To quote our friend Scott Braddock, the hug heard round the world in Collin County last week, where Jeff Leach introduced Attorney General Paxton at his rally in Allen, which had hundreds and hundreds of people. It was one of Ken Paxton's biggest rallies to date. And Jeff Leach, a noted impeachment floor supervisor.
Yep.
And what's the opposite of darling of the party? He is not liked at all by his local county party.
He's a
primary challenge. There we go.
He's a pariah.
He got up there and said, we've not gotten along for a while. He used to be his mentor. Like, that was a close relationship that fractured. And now they're on stage hugging brothers again. And basically what all the Republicans are saying, which is, even if I don't love Ken Paxton, there is a choice, and it is between the godless James Tallarico or Ken Paxton, and you must make this choice. That what they're trying to do is rally a still fractured Republican Party who is still broken after the aggressive primary and runoff fight. I was reading in a Fox News poll, 98% of Democrats are voting for Tallarico, or polling for Tallarico. 68% of independents are polling for Tallarico.
Yep.
Only 89% of Republicans are saying they will support Ken Paxton. That doesn't sound like a ton. And 89, that's a B+. That is devastating in a close midterm election. If you can't turn out your Republicans, you know you're going to lose independents in this midterm election. That's not unusual for any midterm, any party of power during the midterms. To add on top of that, Republicans who are not excited about their top of the ticket. Greg Abbott's back there doing the work, using that $100 million to turn out voters. But if he turns out voters that are going to skip that top race,
right,
which he very well could be, and that I think is going to be the reality of thousands of people. It just depends how many do that.
That's right.
I think is really interesting. So he is pulling out all the stops. He's hugging Briscoe Kane down near Houston, who was also an impeachment manager. We are doing the Everybody Loves Everybody tour. I believe he's in San Antonio tonight on Monday.
It's funny because when I see my Democratic friends in their posts, they're like, hey, if these two guys can get together and hug it out, we should stop eating our own.
Yes.
So that's
and there's still a little friction in the Crockett Tallarico camp. She has said she's doing her work to turn out Democrats for candidates who she supports. She is doing work to turn out Democrats. She's not going to go on the stump for James Tallarico.
No.
You cannot get her to do that.
No.
I would be shocked if I see John Cornyn put his arm around Ken Paxton and say, this is the guy. They're begging him to. I just don't know. He's a rich man. He's a senator. He's going to retire.
He'll be a consultant somewhere.
I can't think of what you could offer John Cornyn for him to do that. Ambassadorship somewhere? I don't know.
Yeah.
I don't think it's going to happen, but weirder things have happened in the year
happen all the time.
2026.
That's true.
So the headline right now is James Tallarico is leading Ken Paxton in a Fox News poll.
Yes.
So that's not a poll produced by either camp. That's a Fox News poll. And why it's interesting, and there was a time when Beto led Ted Cruz in the polls, but there was not a time where Beto broke 50% when it was, it's 46 to 43 and this many undecided.
Yeah.
For James Tallarico to have crossed that 51%, it's 51-48.
Okay.
So that's not leaving a lot of undecideds. I feel like we're all so tired of hearing about this race. Everybody knows. They're like, no, I'm good. Please don't talk to me anymore about it.
The conspiracy theorist in me says that Fox News has just produced this so they get more drama, so they get more eyeballs.
Fox News?
It's loosely news, yeah.
So, yes, that is the current headline right now. Just like it motivates the Democrats who will think they have a chance, it will motivate the Republicans to get out and say, we're behind, we need to run for behind.
Right.
And a lot of these state reps, I've said before, I don't know if James Tallarico's money will buy him a Senate seat, but I do think it will buy several state reps, a blue seat in a formerly red seat.
I think it grabs a few county commissioners.
I think it
definitely
takes a few
impacts
people down.
way down on the bottom end of the ballot.
And so it's where that happens. It's where it's concentrated. You're seeing Democrats heavily target these urban areas. You're going to see Tarrant County, Dallas County, Collin County.
Yep.
They are urban. Like, you might think Collin County is the golf course up in Frisco and the large homes there, but we are urban counties and we vote like urban counties. And so trying to make gains in those Tarrant-Collin-Denton corridor is going to be huge for success, which means if you're living in this area and you're not already getting, I think I've answered more polling calls this year than ever in my life combined.
I'm blocking numbers left and right.
I took a 15-minute one the other day while I was thinking better. I was like, you want to know what I think? Let's go. So that's where we are. It's going to be a fast and furious. I think we're under
we're under 90 days.
I think we're under 90 days now.
It's exactly how I wanted it to be. I'm so excited.
Team chaos. And we're going to get it. We're going to get it. So thank you. And now we'll pivot over to Claire for healthcare.
Absolutely. Y'all take care.
And now we're going to start a segment every month where we go into some deep dives on our policy buckets that we're going to go to the legislature with. And we brought in today a healthcare expert. Welcome, Claire York from Blue Cross and Blue Shield.
Thank you.
And Claire sits on our board of directors, which is even better. So we've got to get this right. Otherwise, it's going to come back on us. So you never know. You never know. So, well, thank you, Claire. We really, really appreciate you taking some time. And since healthcare is such a driver of workforce and all the other things that we try and drive for success here in North Texas, if you had to really take a look at the healthcare challenges that we have, what is the single biggest one that we have here in North Texas?
I think that's a great question. And it's something that many of us probably don't, well, we think about it because really what I would say is affordable, timely care. If I had to put it into one thing, that's the problem. Affordable care at the right place at the right time.
Yeah.
And unfortunately, while care is accessible to us and there are so many world-class health organizations here in North Texas, and we're very fortunate to have that, it really is dependent upon where you live, your socioeconomic status, and the type of care that you might need. And so while really only 1 in 10 people go to the hospital or need hospital care in any given year, there's a lot of other care that's needed, and it's hard to get to it sometimes. And there are certainly areas of North Texas where it's hard to get to the care that you need. And so I think that's one of the biggest challenges that we have in front of us is right care, right time, at the right price.
Sure. I mean, I can think about folks that, don't get the right care at the right time and they just wait and wait and wait. And then finally somebody forces them to go somewhere and it's a lot worse than it should have been.
And then you become that person in the hospital, right? I know we were talking earlier. Stay out of the hospital as much as you can. So getting that preventative care, the preventative care visits, chronic care management, seeing your PCP. Oh, I forgot to say at the very beginning, I'm not a physician. I'm not providing any special medical or healthcare advice from that perspective, but it's really important that, we're able to give people that preventative care that they need so they don't end up in the hospital in a difficult situation.
And to be clear, don't use AI for this stuff either, folks. So you need to go see your PCP. It's
Get a PCP.
Yeah,
go see them.
Yeah, make that happen. My goal was not to be in a hospital, and then my mom was an admitting clerk for like 10 years while I was growing up. So I was always at the hospital for one reason or another.
So you learned.
I did.
You didn't.
You don't want to be there. You don't want to be there. So it's a real challenge. Now, when we're talking about healthcare, we see a lot of pressure on the rural healthcare system. We see are we still seeing tremendous pressure for nurses, for that type of staffing as well? And how does that look here in North Texas? How are we doing as far as that filling those jobs, and what would we need to be doing differently if we're having a problem?
And I would add, what kind of policy can we advocate for to help ameliorate that struggle?
So I think, because of the way North Texas is growing, which is extremely fast, it's hard to keep up. And we need to have a consolidated effort across employers, providers, policy, all of those things in order to manage this continued growth. We have extremely amazing institutions, as we've been talking about, hospitals, and there's a strong talent base. But how do we harness that talent base? How do we manage workforce shortages, particularly, as you mentioned, nursing, primary care? We're seeing it pop up more and more in behavioral health, and then other specialties, particularly in rural areas, endocrinology, allergists, things like that you may not really even be thinking of on your list. And we need to expand our educational pathways to strengthen that workforce development and support retention efforts. we're very lucky. Again, we have over 200 healthcare training programs in North Texas, but we need to figure out how are we taking that power that's being harnessed in those educational facilities and moving that into the workforce? And what are the partnerships that we're developing internally with organizations like Blue Cross and Blue Shield of Texas, with hospital organizations, with others, in order to make sure that we're getting that talent into the workforce in a way that's going to be productive. And so I think we have to continue to have these training programs across, multiple employer-based groups, as well as into that hospital segment and even into our provider offices, to make sure we're harnessing this talent that's available to us, because it's really huge, and we're extremely lucky that we have it in this area.
Yeah, I remember seeing a lot of the nursing program with Dallas Community College, and how built out their facilities are, but incredibly expensive to just get the facility put together. So I can see where that's a real challenge to get. Where's that public-private partnership coming from?
Correct.
Is that all going to be on the hospitals? Are we're asking for our community colleges to pick that up? Does the state fund that? How does that work?
Well, I don't know that I know exactly how it works, but I think it's an opportunity for us to ensure, again, this public-private partnership. We've got a lot of public institutions at a higher level that are educating individuals in the healthcare space today. I know there's a lot of conversation at the policy level. How do we keep those people in Texas? How do we make sure there's job openings for them, and that we're really utilizing the legislature, I think, a little bit to help with some of that from a position placement. I know there's a lot of discussion about residency programs and all that good stuff. But even at the nursing level, how are we recruiting? How are we helping to develop in communities like North Texas, a National Nursing Day recruitment event, or a zillion ideas like that I could think of are probably something we're going to really have to start thinking about. But one of the things too is, I would say that's thinking about healthcare very singularly, in terms of, I have an acute event or I need to go to a doctor's office. Who are the people that are going to care for me in that moment? And if we could start thinking about healthcare a little more holistically, from our school systems, right? School nurses, counselors, people helping from behavioral health perspective, what community resources are being offered in the community, thinking about health a little more holistically, I think is one of the things that we have a challenge as a region, to turn it away from just that one encounter at a doctor's office or at a hospital, to a holistic activity that you're doing all day, every day, wherever you're out in the environment, is really going to be important as we move forward and manage this growth, because we're never going to be able to build enough hospitals and enough doctors' offices to keep pace if we don't include some of these other community investment components, right, around centralized health and well-being. We've been investing, of course, in outdoor fitness courts. I know it's a little hard to think about here in the middle of August,
right?
But building outdoor fitness courts, making sure there's safe walking paths for folks, making sure biking and other things are more accessible to the population, is really important.
Yeah. We putting on my mayor's hat, I think about Fort Worth a few years ago invested quite a bit of money on their Blue Zones project. And that was about finding food deserts and putting something in that place. It was about, finding better opportunities for cycling and hiking and walking and all of those things. Then COVID hit, and I've kind of lost track of where that is. But, cities are looking at how to invest in the community to be able to keep them healthier. Because it's like you said, it's a workforce issue. And if I've got a good, strong workforce, then I've got good, strong businesses. And if I've got good, strong businesses, I've got good revenues, and I can provide the police and the fire and all the other good stuff. But if it goes the other way and that floor falls out of a family, it's a really challenging environment to get them back into the productive side of the ledger. So cities are trying it all different ways, and I'm really excited that Blue Cross and Blue Shield have definitely been in the front of that, trying to figure out, okay, how do we spend less dollars up front so we don't have to spend lots of dollars on the back?
Right. The idea for healthcare to actually be healthcare and not sick care is really something that we don't think about probably as often as we should.
We don't.
And something I'm always talking to the children about, or my children. I shouldn't say the children in general. I talk to
I call them the children. too.
children, the people at my house who I am currently financially supporting. Those people, I try to make sure they understand the importance of not being, on your phone and gaming, getting outside, getting some vitamin D, ensuring that you're, taking in the out of doors, how that's important for your emotional health and well-being. Health being a broader thing. I need to go get my annual physical. I need to get my associated checkups that I'm supposed to get after 40 and all those. Those are great. And we need to be doing all of those things. But really, as you mentioned, thinking about it more broadly, it impacts economic productivity significantly if you have, a lack of general health and wellness. And so the impact to us isn't just a sicker population. It's the economy suffers.
It's
all
not
those
good.
things.
It's not good. So it becomes incredibly expensive now. The other things that I think are really interesting I'm seeing in North Texas is we're seeing a lot, even though it's being pitched more as a rural type of solution, I'm seeing a lot more interest in telehealth.
For sure.
I'm seeing drone delivery companies that are trying to figure out how to get into that market as well. So whether that's delivering drugs or even just blood pressure and home health equipment. So that's been fascinating. Are you seeing that anywhere in your state?
Yes, absolutely. And I think I mentioned just a few minutes ago, there are certain specialties that they're just not going to be a doctor in every single town with that specialty. How can we ensure that people still have access to those types of things? And telemedicine is a great opportunity for us to make strides in that space. I also see telemedicine, again, talking about those people that live at my house, those children, the uptick on their willingness to do things via telemedicine, whether it's talk to their therapist or see their PCP for a cold, those types of things. To be able to do that virtually is going to be huge for us as we continue to grow and as people want that real-time access, so to speak. We live in an Amazon world where you can get something the same day and everyone sort of panics if they can't see their doctor the same day.
Right.
Telemedicine is a great opportunity to better enable that sort of speed to care, is kind of what I would call it. I think sometimes what we forget is you do have to do a little bit of legwork to get to that telemedicine. So you need a relationship with the PCP. Once you have that, it's highly likely they'll open up virtual visits to you. If not, there's lots of virtual providers out there. Most health plans have a virtual provider option. You might need to register first.
Sure.
So register before you get sick, and then you can get that appointment really quickly. I mean, we on my employer plan from Blue Cross have the ability to quickly get an appointment with a virtual provider for urgent care within minutes.
Yeah.
And it's pretty cool.
Yeah.
But I have to have registered. And so
you
people do get a little like, oh, wait, but I didn't register.
gotta get it
So
set
I guess I better get in the car and go to the ER. That's not necessary. You can still register now. But I think telemedicine is here to stay.
Oh.
And I think it's a good thing. The more we can get comfortable with using it, the better access we're going to be able to start to have to those specialties that while many may need a hands-on appointment every once in a while, you don't necessarily need a hands-on appointment for every single
And for
appointment.
seniors who are losing mobility and depend on a caregiver to take them to the doctor, to transition even half those appointments to virtual, change it, maybe their cost for care. And
Yes.
it's
And
incredible.
most recently I saw, my parents are aging and starting to have a few more doctor's appointments. And definitely it's one of those things where it takes the whole day, right? Their whole day is the one doctor's appointment. But to be able to input quality of life, not going to the doctor, but seeing your doctor really quickly in the morning and then using that time slot that you would have used to drive to and from the doctor and sit in the waiting room to do something with your colleagues or friends or to have a good time during the day and really help continue to support that health and well-being.
Right. No, I look at it in my transit hat, and with paratransit services and whatnot. They're having to schedule things 2 days out, especially if they got mobility issues. And you have to have a specialized vehicle. Otherwise, the kids are taking them.
Yeah.
And now you're taking somebody else out of the workforce. It becomes this whole thing. So it'll be interesting to see how that plays out, especially with doctors. Some primary care is moving to more of a concierge type of service. So you've got that push pull in the economy, trying to figure out where do I talk to a doctor,
Right?
and so this I think is a really interesting way, and we've got one of the nation's leaders in remote telehealth, actually in Louisville, so I can always put in a brag there. But
Do it.
it's fascinating to see how that is evolving because before COVID, nobody wanted to be on a Zoom call. Now it's like, oh, hey, doc, let me show you this over a Zoom call.
Yep.
It gets a little interesting. So,
And I think we've seen, I mean, certainly primary care, certainly behavioral health. We're really seeing the expansion in dermatology
okay.
for virtual health. So better access from that perspective. I think we'll start to see it in some of these other areas, endocrinology, where you don't necessarily need to be hands-on to have a successful appointment. Even, we're seeing a lot of virtual come out of PT, where they can remote monitor, how you're doing your visit and, give you live feedback. So it's going to be exciting to see how all of this evolves.
That's
But
fascinating. That'll be fun. So, what are you looking for, or what kind of public-private partnerships are we trying to create now? So, technology's changing healthcare. The crush of people are creating challenges for healthcare here in North Texas. What is the industry looking for or trying to create as far as public-private partnerships or working with government, to help you get to market faster, to move people into this space of health and wellness versus just emergency care?
that's a great question. And I'll kind of take us two directions. So one direction specifically is we have a lot of community involvement. We have some what we call our Blue Impact grants that you can apply for a grant to help support your initiative for any, nonprofit or other activities that might be doing that support population health, health and wellness. Currently, we're very involved with the Corporate Challenge, which supports the Special Olympics. Employers in North Texas, you too can participate.
Awesome.
It is a 10-week Olympic style sporting event, I guess. We just had our kickoff last Friday. So it's going to run for 10 weeks. You still have time to get in. Lots of fun activities and events. I think these are great ways to get people out, understanding what's going on, obviously supporting a great cause like the Special Olympics, but it has a variety of events. There's pickleball, there's bowling, there's all sorts of things. So you
Awesome.
don't have to be a star hurdler in order
Although that
to
doesn't
be
hurt.
involved. It wouldn't hurt. We'd be thrilled.
How
But
do you feel about pickleball, TJ?
Me, pickleball, we'll save that for another podcast.
But I think there's a lot of companies that get involved in that. There's a lot of companies involved in these Blue Impact grants. But on the other side of the fence, we're very fortunate to have some really great state-funded employers as Blue Cross and Blue Shield as their healthcare administrator, as well as some other very large employers in Texas. And the partnerships with them are things that we value heavily. They are really looking at how they support wellness in their organizations and often work with us to pilot items that we can then take out to the rest of the population. So in particular, we work very heavily, like I said, with a number of state entities that want to pilot different wellness activities, different ways to get folks involved in getting their physical every year. If I get my physical, can I get an extra day off? What does that look like? Is that something we'd want to see about implementing in our own population, right?
Side note to our boss: if we get our physical, can we get an extra day off?
Or two.
That sounds.
It's amazing what an extra day off will motivate people
Right,
to
right.
do. And so I think there's a lot of opportunity for us to continue to partner with our really large employers to ensure that we're keep trying. Try, fail, try again, do what you need to do to try to get these wellness activities out there. It's just so important. And additionally, things like telemedicine, trying different vendors, expanding access to different provider specialties, all of those types of things are great ways for us to start to develop those partnerships and see, what's impactful and what's going to stick. And again, the one day off, it
Yeah.
seems to really work.
I
Yeah,
think it would.
I can see it. So it's 2036. 10 years have passed. What have we done to get it right in North Texas as far as healthcare is concerned? What things would you say, hey, we know we got it right in 10 years?
Well, we know we have it right if healthcare is truly healthcare and not sick care. So stronger preventative care programs, chronic condition management, the value of a healthy, I guess is the word I would like to use, a healthy workforce is seen as a strategic asset. That's what I would say.
Okay.
If a healthy workforce is not something that we consider a strategic asset today, it should be.
Yeah.
And getting to that place would be my Shangri-La,
That'd be
right?
awesome.
Where we're in a place where we're really valuing that. And that is going to come from every person really having access to convenient, high quality, affordable care.
Yeah,
When they need it.
in a timely fashion.
Timely,
They need it.
when they
Yeah,
need it.
yeah. And you and I were talking, the big drivers that you're seeing out there are things like stress and diet choices. And those are things that we're going to have to continue to drill down on to be able to help people be successful.
Stress, diet choices, for sure, convenience, right? We're a convenience culture. So if we can't make activities to lower stress, the right food accessible conveniently, that will be a barrier ultimately to health. So it's a matter of really being able to see all of those things, in my opinion, not just, again, checking into that hospital. We're trying to avoid it. Stay out of that
do it.
life goal. And everyone can do that as well. Get your physical.
Yep.
So you can get your free day off
That's it.
and then stay out of the hospital.
I think we
These are
solved.
the-
I think we solved it. We solved healthcare. It's awesome. Well,
It's
Somebody needed to, so might as well have been the three.
well, Claire, thank you so much for spending the time with us and giving us a kind of an overview of where we can go. But for our small business owners, our large business owners, those are the key areas. If we can continue to do that, we can continue to drive the economic engine that is North Texas. So
Absolutely.
thank you so much.
Thank you.